I'm Michele Shermak. I'm a plastic surgeon. I am now very happy in private practice on Bologna Avenue at the Plastic Surgery Center in Maryland. I did spend 11 years on faculty at Hopkins, many of those as Chief of Plastic Surgery at Johns Hopkins Medical Center. And prior to that, was educated through Johns Hopkins in medical school and residency. I spent 6 months additional training in Nashville, Tennessee, studying breast and body contouring surgery. Originally became interested in plastic surgery back in high school. I saw a videotape about craniofacial surgery named Paul Tessier from France, and he traveled the world addressing children with craniofacial or deformities of the face and skull. And I just thought it was amazing. It was a perfect blend of science and art, which were my two big interests. Ultimately transitioned a little more into breast and body and more bread and butter things. It just, thankfully, there really aren't a lot of craniofacial deformities, so I felt it was a little bit narrow of a scope, and I really practice almost the full breadth of plastic surgery at this point. I always meet with my patients prior to surgery. We set up a consultation where the patient will come in to see me, or I'll come to see them if they're in hospital. We try to explore whatever the individual desires to achieve, and whether it be reconstructive or cosmetic, and have a nice discussion about it. I try to give as much information as I can, answer questions, give the full scope of what is available to them, and then we come up with a surgical plan. In general, people reach me after the consultation online if they want to talk a little bit further, or they can come back into the office. But really the goal is no question is not welcome. I really want people to be as informed as possible, because truly they are my easiest patients after surgery. The ones who ask the most questions have all their questions answered, and everything's easy sailing after surgery.